Almost 21,000 people got COVID-19 every day in the past 7 days, double than the peak of cases in April. Based on government's data, about 18 out of 100,000 people are getting sick daily. Many hospitals and quarantine facilities remain near or at full capacity. 12 regions are at high-risk category. Despite this, the government is shifting to a new policy, introducing new alert levels, which it says could help dampen the number of cases and hurt livelihoods less. Granular lockdowns of barangays or households depending on alert levels. The Health Department's basis, cases are only concentrated in some areas.
80% of our new cases only came from a small proportion of our barangays. Lower cases can be achieved when we improve on our minimum public health standards, case detection to isolation time, and vaccine coverage even at lower community quarantine classifications.
Health officials say vaccination drive is also a factor. While around 2 of 100 people died in Metro Manila last year, it was down to less than 1 this year, as 60% of its population got fully vaccinated. Fewer deaths are also observed among the elderly and health workers this August nationwide.
While we can see that there are more healthcare worker infections and cases in the past weeks, their case fatality rate remains to be low, most likely due to the high vaccination coverage and the protection of vaccines against severe disease and deaths.
But health officials admit there could be underreporting as some deaths are reported days, weeks, or even months later. There are reports of people with COVID-19 symptoms dying at home without getting tested. Some unable to find hospital beds also died at home, which could also delay the reporting. The World Health Organization tells the government to tread carefully in implementing the new policy.
Any changes in the policies result in a further increase in transmission. We need to ensure compliance with the restrictions. If we relax further, it is likely that with such a transmissible variant here, we will see more cases.
Just last week, Philippine College of Physicians President Dr. Carolyn Bonquin also reminded the government there should be clear and specific guidelines to avoid confusing the public. Carolyn Bonquin, CNN Philippines.